But what does nature do to keep fungus under control? Or in other words, what in nature battles fungus? Well, as our main concerns as humans and also animals' concerns are to avoid viral and bacterial infection. So we have mechanisms for that. The plants, they're trying to avoid rot, which is fungus, and they're trying to avoid insects. So plants will make insecticides and they'll make fungicides, things that kill fungus. And so we find that our best antifungals are the same compounds that plants use to kill fungus. This is the only thing that I've found that works, and I've got my ears very much open and to the ground. I ask people, we've had patients who've gone to Brazil and India and Japan and all over the place, and people have not found a better way to get fungus under control, and yet this works remarkably well. How well does it work? Okay, we used to deal with diflucan and nystatin, the standard conventional medications, and we worked with that for several months. Then we moved on to these plant antifungals. Well, I can get more mileage in 5 days on these plant antifungals than I can get on 2 months of nystatin and diflucan. And this is very high dose daily nystatin and diflucan. It's very convincing. This is how it works. And you're treating in 3 cycles. For the liver first, then for the developed form of the fungus, and then the 3rd cycle is to treat for the spores, because it'll make spores as a defense. Again, a very intelligent organism. These 3 cycles or steps take about 6 to 8 weeks. How soon do you feel better? Usually by day 4 or 5. Your greatest changes happen in the first few days. And in the kit, it talks, you get a CD that talks about how this works, and it's also written down, so you know what to expect. So that's the first part, and the most important part. The medicine accounts for at least 50% of the effectiveness. In other words, if you don't have effective medicine, you're missing at least half of any program. All right, second part is obviously diet. The diet has to be correct. So most people would assume that sugars and things like that are your main culprits, and that's not really the case. The things that got you into trouble usually are not diet. Usually it's the antibiotics you received long ago, having swam in chlorinated water, long ago, birth control hormones, the use of steroids like hydrocortisone, alcoholism, regular alcohol use, things like that. That's what brought up the problem. The dietary issues can keep it going, and so we have to get that under control. But it's not, again, it's not what you might assume. The fermented foods are the worst ones. So that's going to be your malted barley flour. This is barley that's been sprouted and heated and turned into maltose sugar. This is what makes beer into beer. Now you'll find maltware in almost all your cereals, in your breads, cookies, crackers. Before the 90s it wasn't there. It used to be Ovaltine, malted milk balls, grape nuts, and malto meal. That was it that had malt in it. Now today it's hard to avoid it. Why is it in the foods? It makes the foods addictive. You will crave it because it has malt in it. This is why we have so many people with their beer belly starting in their teens. Or even worse, excessively skinny. This seems to be the worst fungal person. So malt is our number one one you have to avoid. And be careful, even in the health food store. You'll find it in the granolas. I went over to a health food store where we looked at tons of granolas, and 80% of the granolas had malt in them. So you just got to watch out. Malt's first, then vinegar. You'll find this in your ketchup and your mustard and your mayonnaise and your salad dressings. Chocolate is next. Chocolate is a fermented bean. It's fermented for anywhere from 4 to 9 days in the tropics under banana leaves with lots of yeasts poured on top of it. And this is to soften up the bean, and the yeasts actually convert the sugar in the beans to alcohol. So this is why people go crazy over chocolate. The important thing with the program is, as you said, as I noticed also, that you can live without chocolate once you start on the antifungals, because it takes your cravings away. It's not a matter of saying, boy, I feel great, but I sure miss that chocolate. So for most people, it's, they're just amazed that this isn't happening. There's other things you have to avoid: the pickles, the alcohol of any form, even non-alcoholic beer, the aged cheeses, the ones with a strong odor, strong flavor, soy products, steak sauce, cottonseed oil, peanuts and nuts, that's all nuts, the apples, grapes, bananas, coffee. Those are the things that are primarily the food issues. And you get a book and you get a list that shows exactly what you need to avoid in order of how bad they are. And then finally is probiotics, and this is live bacteria supplements that are going to replace the dying yeast. And so those have to be the proper ones that are sent refrigerated. So this program is 6 to 8 weeks long, and then you do a little maintenance program after that. The large majority of people are going to feel better, again, if they have a Candida problem. But this does work very, very well.
Okay, yeah, I can attest to that. I mean, I was just so amazed that within 4 days, I had lost all cravings for everything. I just couldn't believe how easy it was. I didn't have to diet ever because I just didn't have any cravings, so I didn't sit down and eat till I was sick every time I sat down to have a meal. And I didn't change my diet a great deal, even though I followed your program during. I did this for 3 months because I did a double program because I felt I needed it.
I remember that, yeah.
And but anyway, at the end of that 3 months' time, I had lost about 60 pounds, and I was feeling fantastic. And I haven't had to adjust my diet in the sense that I eat what I want when I feel like it, but I keep it in the back of my mind.
Right.
I don't want to overdo anything.
Right. Well, and people end up, when your cravings are gone and you have a knowledge of what's good for you.
Right.
And again, this is not a low-carb diet. It's, you're not restricted on carbs. You avoid corn and rye initially, but you can go back to those. But you become attuned to what makes you feel good and what So if the yeast feeding foods, you lose your appetite for them and they don't make you feel good, it's not hard to avoid them.
Right.
Most people don't lose 60 pounds. I mean, that's fortunate. You've got, you're a tall man. My experience is that people tend to lose about 10, 12, 15 pounds on average. And that's, again, without dieting, just sticking to it. And they'll lose it right around the middle. That's the common thing. Then we have people like you who can lose 60, 70 pounds, and that there are certainly those also. But I usually tell people 10 or 12 pounds is what you can expect. Now, a person who's thin and a small frame, obviously they're going to be more in the 2 to 3 pound category.
Okay. Let's see, there was something else that I was thinking along this line. That on the probiotics.
Yes.
I know I've been looking for a long time for probiotics, and I know that you just mentioned that they need to be refrigerated. But I was talking to a guy recently who I believe sent you some samples
I've
of
got
products.
them. Yes.
Okay, and I just wondered if you've had a chance to evaluate them.
I haven't. I've just muscle tested them on 2 people. It wasn't too favorable.
Okay.
It's interesting. Freeze-dried bacteria. I don't know if that works or not.
Yeah.
The manufacturer of ours has been doing it for a long time, and they've just found that refrigerated is important. It's based on this. The warmer the temperature, the more active the bacteria, and the more they eat. So when you put back probiotics are live bacterial supplements like you would find in yogurt. And then, of course, you're using milk as the food source there. Now, we can do it in capsules also. And these are live bacteria that repopulate your body, not your digestive system only, but it will go out to the skin and everywhere with the proper bacteria. So you can get a bacterial dominance to make it harder for yeast to show up. Because a bacterial population is when something else tries to come in, be it virus or yeast, it'll say, look, I'm here first. So that's part of your defense. Anyway, those have to be live, and to keep them alive, we keep them at cool temperatures so that they're not very active. You can put a certain amount of food substance in the capsule, and the warmer the probiotic is, the faster they'll eat it up. And when they eat it all up, then they die. So what we find is that we have our preparation, the New Flora, can go up to 10 to 14 days at room temperature or below, and you'll still have the 25 billion colony-forming units, because they put out more than that in the factory, but it's always progressively dying as you have it. So they know that you can still have a viable or active probiotic with that.